definition, a condition in which the primary characteristic is excessive accumulation of fluid in the brain. Causes of hydrocephalus. Hydrocephalus is not very well understood. Doctors say it may result from genetic abnormalities or developmental disorders. Real causes. Other causes may include complications of premature birth such as intraventricular hemorrhage, diseases such as meningitis, tumors, traumatic head injury, or subarachnoid hemorrhage. Causes continued, which throws back the exit of CSF from the ventricles to the cisterns or eliminate the passageway for CSF within the cisterns. CSF is known as the water on the brain. The water surrounds the brain and spinal cord. The excessive accumulation of CSF results in an abnormal widening of spaces in the brain ventricles. The widening causes potentially harmful pressure on the tissues of the brain. Symptoms of hydrocephalus. During infancy, the child's head becomes noticeably enlarged. Other symptoms are vomiting, sleepiness, irritability, downward deviation of the eyes, and seizures. In older children and adults, the symptoms are different because their heads cannot accommodate the amount of CSF in the brain like children and infants can. Symptoms include headaches followed by vomiting, nausea, blurred double vision, downward deviation of the eyes, problems with balance, and irritability. Treatment of hydrocephalus. A shunt is a flexible but sturdy plastic tube. A shunt system consists of a shunt, a catheter, and a valve. Treatment continued, often treated by surgically inserting a shunt system to drain the fluid. The system that diverts the flow of CSF from the CNS to another area of the body where it can be absorbed as part of the normal circulatory system. Statistics of recurrence. Fewer than 2,600 cases of hydrocephalus occur every year. This is a diagram of where a brain shunt is placed in a patient with hydrocephalus. Brain shunt. When inserting a brain shunt into a person, the patient is scrubbed with antiseptic from their scalp to the abdominal just to prevent infection. Incisions are then made in the head and in the abdomen to allow the surgeon to pass the shunt system through the fatty tissue. The hole is then made in the skull, opening the membranes between the skull and the brain to allow the ventricular end of the shunt to be passed through the brain. The abdominal end is passed into the abdominal cavity through a small opening in the lining of the abdomen where the excess CSF will eventually be absorbed.
Created using Powtoon.